State is reporting 11,722 new cases of COVID-19 over the past 2 days. So the average at about 5,800 cases a day. That's just a bit higher than what we saw over the weekend. But the really staggering number here, look at the left side of the screen, 330 more coronavirus deaths being reported, 230 of those coming from a review of vital records.
And there are some encouraging signs, though, in the 7-day moving average. Taking a look at the past 3 Wednesdays, you can see today's number has fallen below the dip that we saw over the Thanksgiving holiday. But meanwhile, Metro Detroit hospital systems are continuing to feel the crush of COVID patients. Today, Henry Ford Health held a press briefing to express their ongoing concern. We had our Dr. Frank McGeorge in on that call. He joins us now with an update. Frank, I have to believe none of this, though, comes as a surprise to you after what you saw in the ER just this past weekend.
Exactly, Kim and Devin, not at all. Unfortunately, extreme waiting times just to be seen, and I'm talking about multiple hours, has become the norm. And if you need to be admitted to the hospital for any reason, that wait often easily extends into days. The frustrating part of it all for healthcare providers like me is that it doesn't need to be like this.
No matter which hospital you're talking to, no matter what health system you're talking to, the word that you're going to hear about current conditions in the state of Michigan is crisis. We are in a crisis. There's no way around it, and there's no way to sugarcoat it. On any given day, our emergency departments are either at capacity or close to it, and oftentimes serving as inpatient units because we don't have any beds available in our standard inpatient units or our ICU.
That's Bob Riney, Chief Operating Officer for the Henry Ford Health System. He and Dr. Adnan Munkara emphasized the biggest contributing factor to this are people who remain unvaccinated.
About 75 to 80% of hospitalized patients with COVID are unvaccinated. And over 85% of patients who are in the ICU or are on ventilators in the ICU are unvaccinated.
Dr. Jackie Flom Carlson cares for COVID patients in both the ER and intensive care unit.
It's heartbreaking because we know that the patients are led astray by this social media or false information, and it's so heartbreaking to walk them down this path of death, knowing that it was preventable.
Now, these long waiting times for care in the hospital is seriously wearing on everyone. And I understand patients are completely understandably frustrated and often angry, but that's led to uncivil and frankly disrespectful behavior toward our staff, kind of like what's being reported in airline passengers. The only thing I can say is everyone is doing their best in really draining circumstances, and we're pleading for a little kindness.
Would be nice, Frank. I know you don't want to tell patients not to come to the emergency room if they need to, but how are you advising people with maybe problems that aren't quite as urgent?
Well, you know, there are the obvious, of course, primary care doctor, an urgent care center, or even a telemedicine visit. But, you know, one other thing that we're seeing more of are people coming to the ER to get COVID tested. And we actually want to discourage that. Frankly, testing is available all over the place, and you do not need an ER for that.
Yeah, treat your doctors and nurses well so that they can treat you. All right, thanks, Frank.